Risk assessment is a process that we go through the different hospitals or other organizations. We go through and do a bunch of interviews, collect a lot of data, and report that data up to the leadership of the organization so that they can understand the different risks that they're facing. A risk assessment is important for multiple reasons. Some of those reasons include the EHR, meaningful use requirement, requires a risk assessment for every period of attestation. The HIPAA implementation security rule requires risk assessments. The ONC is beginning to do another round of auditing. It was just announced earlier and the audits are going to will include hospitals and business associates to make sure that they are compliant with the HIPAA implementations. A risk assessment commonly involves different parts. One of the first parts we do is department interviews. We will go into different meetings with various departments that the organization chooses, sit down with those departments and discuss what processes they have that could result in risk to the organization. Those interviews also normally involve some user training. So in instances where we find something like users emailing patient information outside of the organization unencrypted, we will let them know that that is not something that is considered HIPAA compliant and that they should they should review their organizational policies. Another component is vulnerability scans. A vulnerability scan is a technical assessment of the organization's network. It can unveil some information like missing operation patches, missing operating system patches, default credentials, as well as unnecessary services that might be running in an environment. It also involves a compliance assessment. The compliance assessment is when we sit down with leaders of the organization and go through the HIPAA implementation security rule one part at a time and evaluate whether the leaders believe that they have compliant processes and policies and procedures in that space. It also involves a wireless assessment where we will have a technician come out to your location and look for things like rogue access points and insecure wireless protocols. There's also a web component where we will look at the different there's a web component where we will look at websites that you want us to evaluate for common security vulnerabilities and also validate whether those vulnerabilities exist when possible. And there's also another component where we will look, and we call it open source intelligence, and that is where we look at public websites for information about the organization, as well as things like posted vulnerabilities that is out there for anyone. We'll also look for, say, the contacts that are out there for different things for your organization. We will look to see if they had any breached passwords associated with that account. There's also another component which includes a policy assessment where we review the hospital or the organization's policies or the organization's security policies for things like conflicting policies across multiple policies and also not having the correct not having a policies that align with the HIPAA security implementation rule. The healthcare industry is a very rich target right now. Medical records can be worth $50 or more. I've seen some reports where a medical record can be worth $362 if it's complete with Social Security numbers. There's also the additional risk of having what we'll say is celebrity patients, people that are famous or politicians, where access and leaking their medical information could have a bad effect on their reputation as well as that of a hospital's. There was also an incident earlier this year where there was a breach of patient information. The investigators believed that the breach was caused by a government outside of the U.S. trying to gain information about biomedical devices. So there's also a government aspect to it as well, where they will hack into healthcare industries for information. CareTech provides a comprehensive risk assessment, which also provides user training. We'll look at the risks of the organizations from multiple angles, which includes both technical and organizational risks. CareTech also strives to provide executive-level reports, which are both executive-level reports which communicate the risk to leadership in a way that they understand, as well as provide things that are actionable for the organization.